across the nation and here in Connecticut, doctors are also treating conditions that are non-COVID related, and that includes the Hartford Healthcare Ayer Neuroscience Institute Multiple Sclerosis Center. Dr. Derek Smith, a neurologist, joins us now. Thanks for being with us, Dr. Smith.
Thank you.
First, can you tell us about the multiple sclerosis program at Hartford Healthcare?
Yeah, it's a very exciting time for us, actually. It's growing very quickly. We're adding new types of providers all the time. The basic vision is to provide care close to where people live. It used to be that MS patients would have to travel hundreds of miles to find specialized care. And we are actually providing it in several locations in Connecticut. They require a lot of different elements of care, imaging, IV treatments sometimes, and ancillary care like physical therapy and social work.
Tell us about how the treatment of MS has evolved.
So 27 years ago, there were no treatments available for MS, no FDA-approved treatments. Now we have over 20 FDA-approved treatments. The treatments are designed to target the immune system, and this is an example of the success of our system of blinded clinical trials, randomized clinical trials, producing effective new therapies. And the good news is the newer therapies are better than the older ones.
And how has COVID-19 affected people with MS? Tell us about that.
In general, people with MS are not at any different risk from COVID than anybody else. But because we're using therapies that affect the immune system, there is concern in that regard. Many people with MS are mobility impaired, and now we're further localized in terms of our travel. So, for example, I've noticed people with MS aren't filling their prescriptions as much. Maybe they don't want to go to the pharmacy.
And what would your advice to them be?
People should fill their prescriptions, especially for the immunotherapies. If they have questions, the best resource is their healthcare provider. One of the things we did when the pandemic hit is we carefully analyzed all the different therapies that we were giving people and came up with a risk assessment that is sort of tailored to individual circumstances. So I think if there are concerns, that's the best resource.
Okay, let's talk about resources available for more information relating to COVID-19 and MS.
So we are involved in networks that are collecting information about the various risks that may arise with treatment. Some treatments may actually decrease the risk and some may increase it. We just don't know yet. So MS centers throughout the country are sharing information in this regard. And hopefully we'll have a better idea soon, but this is being done, for example, with the National MS Society, and also I would mention Hartford Healthcare, hhchealth.org as a good site.
And how important, when we come out at the other end of this, will be sharing all that information be for patients with MS?
Well, time will tell. We may not get clear answers for some time. So we'll just have to keep our eyes peeled and continue to data share as best we can.
All right. Dr. Derek Smith, keep up the good work. We thank you for bringing us up to date on Hartford Healthcare's MS. Thank you very much. We appreciate it.
Thank you.
Thank you.